Welcome to this webinar, everyone. Today we'll be discussing all things healthcare policy, and in particular Britain's healthcare challenges. I'm Peter Ferguson. I'm a senior consultant at Hanson Search across the public affairs and policy team. For those who don't know who Hanson Search are, we are a communications headhunter globally. And we've been working in this space for over 20 years. And I'm absolutely delighted to be joined by an absolutely brilliant panel of experts today, who I'll be introducing shortly. I just want to say, just before we get started, this session will be interactive. So during the session, if you pose questions into the little box at the bottom, and then once we'll do at the end of the session, I'll come to those questions and we can ask the panelists, and hopefully, session will be super interactive, which is great. I'd like to introduce the panelists now. So firstly, we've got Emma Greenwood, who's a director at Hanover Communications within the healthcare team. She has been in this space for a number of years now. She provides senior counsel to clients across the policy access and engagement. Prior to joining Hanover, Emma was Director of Policy and Public Affairs at Cancer Research UK. Delighted to have Emma on the panel. We've got Caroline Gordon today, who's on the panel as well. She's partner of and head of healthcare at WA Communications. Caroline leads an 18-strong team supporting clients across the health and social care space. She's worked in politics and healthcare for the 2 decades, helping politicians across national and local government, healthcare charities, and working in the consultancy space. Next, we've got Amelia Sunkaraneni. She's an account director at Incisive Health. Amelia leads communications strategy development for projects across a range of pharmaceutical companies and healthcare providers at both UK and global level, and also is a trustee for the Joe Cervical Cancers Trust. So absolutely brilliant to have Amelia on the panel, so thanks so much. And then last but not least, we've got Ed McRandal, who's director and head of healthcare at Lexington Communications. Ed leads a 28-strong team, leading clients across the health sector, providing strategic comms and public affairs support. Ed has over 12 years experience in the space across agency and government. So thanks so much, panel. And it'll be a really interesting discussion today, I'm sure. Let's get started to the questions. So today we're going to be discussing all things healthcare. The UK healthcare system is currently under immense pressure, with long wait times, lack of funding, staff shortages, and delays in treatment for millions currently. So it's an incredibly difficult time. This unsustainable pressure on the health and social care services has definitely been exacerbated by COVID. And it's really highlighted a lot of vulnerabilities in our healthcare system, and also the health of the population as a whole, from obesity to mental health. And now this year, with the cost of living crisis, this has only been worsened further. So we're going to be diving into a lot of these issues today. So the first question I'd like to ask the panelists, and I'll come to you first, Ed, on this one, is the pandemic has placed unprecedented pressure on healthcare services. This has led to delayed and expected and routine treatments for millions. How can the government tackle this issue and reduce wait times for those patients?
Yeah, sure. I can kick off, and hello, everyone. I think the first thing to say is that it's important not to overstate quite how bad things are at the moment in terms of wait times, in terms of the historic nature of the backlog. I mean, we're at the worst levels we've seen in a very, very long time. And I think there is no quick fix in doing that. But I think broadly, there's 2 things the government needs to focus on, is about preventing fewer people getting into hospitalisation and emergency care through effective prevention, be that in some of the areas, Peter, you mentioned, be that obesity, be that mental health, be that in terms of, diagnosing people earlier. But also on the flip side of that, it's about making sure that when people are in the system, that they are essentially triaged as quickly as possible and that we can get them out at the other side so that we don't have bed blocking. We don't have the situation where you miss more kind of emergency presentations because you have patients that you can essentially need to move out. So to try and give a short answer to what is a huge problem, I'd say those two things are certainly priorities.
Thank you, Ed. That's brilliant. And Amelia, I'll come to you next.
So I think in the long term, we all know that we need sustained increases in the NHS workforce, investment in capital, in social care, and as Ed was touching on, a renewed focus on prevention. But the fact of the matter is, this winter, in the here and now, there isn't going to be any more staff, there's no more money, and you can't prevent illness overnight. So I think there needs to be a really sharp focus on how can you actually make progress on reducing wait times in the short term within the resource that we already have. So I think in that context, we're talking about things like looking after the staff that are already in the healthcare system, not just talking about recruitment, but that retention piece as well. Ensuring that the money that is available is actually accessible. So like the £500 million discharge fund, so that local leaders can use it. Innovation in service delivery. So obviously there's been a lot of focus on how do we unlock capacity in the independent sector of late, but then also working across the system to tackle backlogs, not only in acute care, which is where the focus tends to lie, but also in mental health care and in community care to ensure that you're not just moving patients from one place to another.
Thanks, Amelia. And Emma, I'll come to you next.
Yeah, I mean, Amelia's completely right about the here and now and the challenge. And however, what I would say is that there is always a crisis that seems to distract government from grasping this fundamental NHS workforce problem. And if not now, then when? I mean, I feel like everybody has been talking about this for over a decade. And at some point, somebody's going to have to really grasp it and just double down on investment in and just really boost those numbers. And actually, I think if they were seen to do that, that would have a significant impact on the morale of staff in the service now, if they felt that they were being invested in. A couple of things I'd just add to Ed and Amelia. So I think there are some really great examples of innovation, and if we could just supercharge them and really embed them across the service. So in diagnostics, the role of community diagnostic hubs, the straight to test initiative, so GPs and secondary care aren't ping-ponging referrals between themselves. I mean, just in the last couple of months, there was this amazing example out of Guy's and St Thomas's of their high intensity theatre list, where they were just getting through, I think it was double the number of patients in one day by transforming their approach to surgery. The final thing I'd say is I really think there is much more that could be done in partnership with the charities and industry. You know, these organisations are disease experts. They often understand the pathways in a way that, you know, no one individual in the NHS necessarily can. They have funds, they have innovative ideas, they want to partnership and pilot. They can do tons to help streamline pathways, invest in the workforce. So I just think embracing those other opportunities is, you know, at a time of crisis is really, really key.
Thanks, Emma. Really good insight. And Caroline, I'll come to you next.
Yeah, thanks. And I agree with everything that's been said. I think as well as it being a crisis kind of for the NHS and for patients and for the workforce, it has the potential to be a real political crisis. And, you know, it's one of those things, the kind of waiting times. It's one of those things that firstly, most people know someone who's been affected, so it doesn't feel like an abstract thing over there. It's you know, people know people who have missed out on operations, there's been delays, there's been somebody stuck in hospital or can't get the care that they need. And it's also one of those things that when they kind of stand on the news at 10 and the chart goes up and you just see the lines going up and up and up and there's nothing doing to bring them down. And I think that's why you're seeing kind of Steve Barclay trying to do something to get a grip of it kind of politically. And we're starting to see more movement now in terms of you know, yesterday it was being reported that, you know, they're going to create kind of super floor, bringing the senior leadership of NHS England together with senior leadership in DHC and ministers to kind of try and create that sense of, you know, I'm on this, I'm driving this. You know, he set up the Elective Care Recovery Task Force under Will Quince to try and identify with Jim Mackey kind of how they can use more capacity from the independent sector to kind of drive through some of these reductions in, or, you know, kind of uptick in capacity. What's interesting specifically about some of that elective care piece is that, you know, it has been tackled previously. You know, when the new Labour government came in and kind of, there were huge waiting lists then, they took a very clear position, you know, make it a big political priority and massively increase capacity. And I think we will start to see kind of more and more of that real single focus, because the kind of political risk on top of all of these kind of genuine risks to patients is very acute. And, you know, we know that government's in election mode, and, you know, in kind of, you know, something must be done. They are going to have to try and tackle in the face of these massive challenges.
Thank you. Yeah, really interesting. Thank you. Well, yeah, we'll move on to question 2. So Britain must continue to improve the healthcare system. COVID has revealed many vulnerabilities in the health of our population, from obesity to mental health. What new policies, initiatives can this government bring to improve the healthcare in these particular areas, and wider, anything across healthcare really, that you believe to be a vulnerability across the UK? I'll come to you first, Amelia. All right.
So I think there are really 2 parts to this question, right? One is, what should the government do on prevention? And the other very closely related question is, what should the government do to tackle underlying health inequalities? So on the prevention piece, if the government's really serious about it, then I think it has to start reversing the cuts in public health budgets. And it also needs to be bold in its long-term ambitions, because what we've seen of late is the government rowing back on various plans to say ban buy one, get one free offers. And there's been a noticeable lack of response to the Calm Tobacco review. But I think if we go back to the question, what we all know COVID really exposed are those completely avoidable and unfair health inequalities that exist in society, be it people from certain ethnic minority groups, from more deprived backgrounds, for people who are disabled, or from excluded groups like those experiencing homelessness. So at a national level, the Health Disparities White Paper is still nowhere to be seen. Obviously, it's been a turbulent time in politics of late. But to try and end this on a somewhat positive note, I do think that integrated care systems present a genuinely interesting opportunity to tackle health inequalities. It's something I'm working with a number of clients on. Be that through bringing together the NHS, local councils, as Emma touched on earlier, the role of the voluntary sector, and also the opportunity to make some really smart use of local data to inform targeted interventions to the people that are most vulnerable in society.
Thank you. Really interesting. Caroline, I'll come to you next on this one.
Yeah, no, I think you know, Amelia's covered lots of stuff there. I think there is something really interesting, kind of 2 parts. I mean, these are long-term challenges. So again, you know, I think it's probably going to be a recurring theme, isn't it? And not many quick fixes here. And this is probably one of the longest to try and tackle. And I think in line with what Amelia was saying about the kind of the local population health piece, there's also something wider about kind of cross-governmental mindset around, you know, improving health is about improving much more than health, you know, the wealth of the nation, and the kind of strength and kind of security of the country through improving the nation's health. And we have an opportunity, I think, you know, almost in the face of the massive challenges that we face, to really focus on bringing together cross-government. And it's always very challenging, but, you know, what is the role of housing? We start to see these terrible stories of the impact of poor housing on health. You know, what is the role of employment? How can those things be looked at in a more kind of holistic way? And it goes back to kind of what Michael Marmot was saying sort of 10, 12, 15 years ago, and saying again in the last couple of years. And I think, you know, so that's one side of it, that kind of holistic piece. And yeah, the other side of it is being brave in taking long-term decisions. You know, this kind of flip-flopping, you know, as Amelia said, what's happening with health disparities, you know, it was very much exposed during COVID. Something was happening, you know, Sajid Javid was really focused on it. We know Amanda Pritchard is very focused on health inequalities and wants it to be a kind of a driver of decision-making from the centre, but without a kind of clear long-term strategy that has commitment for the long term, it's going to be very challenging.
Interesting. Yeah, I'll come to you next, Emma.
Yeah, I mean, I completely agree with what Caroline was saying, actually, around just this mindset piece. I really think that, this was the case before the pandemic, but the pandemic has really exposed that we have a service that does really quite well, actually, at treating people once you get the people in, and once you get through waiting times, etc. We do know we have some of the most amazing research in this country and innovation, and we do know what best practice should look like and how to treat people. But fundamentally, that service is being overwhelmed because we don't have a nation and a service that focuses on early interception of disease and indeed prevention of disease. And I think it would be fantastic if we could get to a place with a government and indeed cross-party that really wanted to see a genuine shift to a service that can deliver on prevention and critically on early interception of disease. I mean, health in all policies, essentially, as Caroline was just talking to, would be such a shift, and I think would mean that we weren't in a situation where we kept rowing back on some of these really fundamental government-led measures that could be taken to do everything possible to create that environment. I think when the mindset seems to still be that these sorts of measures could, aren't right at a time of a cost of living crisis, etc., it just shows that there isn't the level of support, understanding, and that they are not embedded in a kind of a national narrative in a way that I think we all strongly believe. If anything, these represent, smarter choices, cheaper choices. It protects young people. So for me, it's kind of, there are a whole raft of things that aren't new policies. They're just policies that we actually need to commit to and stay committed to. But to Caroline's point, I just think there's a much more fundamental mind shift needed to truly kind of get agreement on the vision of what our future needs to look like, and therefore stick to a series of policies that are going to take us on that journey there.
Great, and I'll come to you, Ed, to finish.
Yeah, and look, I think I agree with a lot of what's been said, and I think the fundamental challenge is that long-term piece, right? And I think it's reconciling at the moment that tension between, NHS trust leaders at the moment are just trying to get through the winter. The government is just trying to make sure that the health service doesn't topple in the coming months, and then reconciling that with the fact that health inequalities, the spending you put into that doesn't happen within a year's cycle of NHS spending. It takes 5 years. With more entrenched things, it takes 10 years. And what that requires is, on a political level, quite significant bravery from the government, because they may not reap the benefits of the decisions that they make. And that is fundamentally the challenge that we have. That said, I do think there is some causes for optimism, albeit I'm quite pessimistic on this, in the sense that you do have some good programs like the Core 20+5 program, that's, going back to Amelia's point, is something that will enable us to make sure ICSs are looking at what those high impact interventions are in and around reducing health inequalities. And that's, some of the early areas, such as, in cancer, mental health and others, be really important. I think what's really key is that gets kind of expanded as a program and gets the political and long-term support it needs, as otherwise we're just going to be having the same conversation this time next year as frankly we probably did the several years before.
Yeah, very interesting. Thanks, all. So I'll come to question 3 now. So one of the main challenges for the government, NHS, is definitely the social care system. And there's been obviously a huge amount of pressure on this for some time. I think that was again exacerbated by COVID, driven by a lack of staff, lack of funding. How can the government look after this nation's most vulnerable? I'll come to you, Emma, first on this one, if that's all right.
Yeah, I mean, goodness, this is the biggest challenge of all, really, isn't it? And I think a couple of things. So we fundamentally need to get this much needed increase in funding into the system, and it's in many ways understandable why that hasn't really happened to the extent that's required. And I mean, I don't know, I'm a bit of a pessimist on this. I don't know if it's possible to reset the national dialogue on this agenda before the next general election. It might be that we have to wait till that election period to go back out to the public to have the much needed conversation about how we fund this approach. And you know, because it has to be, society has to be on board with whatever measures are in place in terms to increase this. But I would be amazed if you know, all the polling seems to suggest that the public don't want to see action in this space, given experiences during the pandemic, given the experience now during cost of living crisis and how that hits those that kind of need it the most. So I think that's one thing. And, you know, just fundamentally, you can do all the other things, but without that funding, it's never going to embed in the way that you need it to. I would hope that the shift to ICSs and probably most importantly, the role of ICPs in this will unlock some different approaches and really see that integration that we've tried many times before, but never completely unlocked across the board. I think, you know, in a few key areas across the country, we absolutely have, but never across the whole. But it will really need quite strong leadership from within social care, which I think needs to mean that we also see that leadership mirrored at a national level. You know, it's really interesting, this story around NHS England senior leaders moving into a shared open office in the Department of Health and Social Care. I would love to know, you know, I think that's going to be about 200 people potentially in an open plan space. You know, how many of those senior leaders have social care as genuinely a core focus? I'd love to know that. And if we can't get that right at a national level and have excellent leadership and prioritisation, expecting to see senior leaders within the social care system on the, you know, to regional level feel empowered and motivated to fight some of the really difficult challenges around integration is going to be tough. So I think this needs to be kind of from the top all the way down, a complete reset of how important this is and how much of a priority this needs to be for ICPs, given everything else that they have to work on.
Thanks, Emma. I'll come to you, Caroline, next. It's all right.
Yeah. It's really interesting to hear you say, Emma, about the kind of national conversation. I was reflecting on it. And this does feel one of those issues ripe for one of those big kind of, you know, population-wide consultation. It really does feel like we need to get to a position where people understand that long-term need, the kind of the personal responsibility that people can take in order to kind of fix some of this issue. Because I agree, I mean, how gutting must it have been for the sector to have gone through the political drama of the social care levy in the last few years, and then just to have it kind of swept away in one sentence in a, you know, in an emergency budget that didn't even last 2 weeks. It's kind of, who is going to have the political courage to go again and take on all of those kind of interests who are against it? So I think that was really, really disappointing. And just to build on what you were saying, Emma, as well, about the kind of the integration, I think the thing we also cannot forget is just how demoralised local government is and how stretched and pressured they are there. And the idea, again, that, you know, kind of got to build ourselves up in this very, very challenging situation is, you know, I think a kind of a bit more national sort of respect and gratitude maybe to the local government sector, as well as the kind of the NHS and that workforce, and however that plays out, I think is going to be very important, because, you know, obviously the two working together, trusting each other, looking for solutions is going to be really important.
Thanks, Caroline. I'll come to you next, Ed, on this one.
Yeah, sure. And again, I'd agree with a lot of what's said. And I think national leadership is one of the fundamental problems here, particularly around social care, which I guess I'll touch on first, in the sense that, you know, we've had over the last 12 to 15 years a series of promises, from the Deal Not Review to the social care levy to all the debate around the dementia tax, that we were going to set out and we were going to solve those challenges of social care, which is so critical actually to a lot of the other challenges that exist within the health service. And I think fundamentally that's not going to change again until we get that kind of real firm political direction, because actually I think it's a real challenge for people who work in the social care sector to have a sense of what the strategic direction they should be going in is, because they don't have that commitment on what the funding levels will be in the long term, what the mechanism of delivering it is. And I think we really need that kind of political will and sentiment. And I just like finish and say I completely agree on the local government issue. What we've seen on the last few years is we've seen local government essentially being told you have to keep council tax rates low, freezing of funding, but at the same time passing the buck because it's an easy way of deflecting blame in a political sense. And I think we do need to actually start seeing that as a different model, a different way of developing things, and actually look at how that more localized model of care can actually deliver things in a much more effective way.
Thanks, Ed, and I'll come to you last, Amelia.
Yeah, I think everybody's right that the political will and the political direction is really key here. I mean, in the short term, there has been some additional funding announced for social care in the autumn budget. When Steve Barclay was in post the first time over the summer, he said he would look to fill gaps in the social care workforce by increasing overseas recruitment. But of course, these are sticking plasters. And I think almost to take things at an even higher level, one barrier to widespread system reform is the fact that I think too often we see social care as simply being a means of enabling hospital discharge, whereas perhaps more progress would be made if we recognised it as the service that enables people to live fruitful, active and healthy lives. And that's actually something that the Law's Adult Social Care Committee just picks up on in a recent report, because I think that framing of the debate at the moment just isn't quite right, and is possibly partly why I think the King's Fund said in the past 20 years there's been something like 15 white papers and green papers on social care. So the question is, why are we still here?
Interesting. Thanks very much. I'll come to question 4 now. And I think this is, affecting everyone, and obviously goes beyond healthcare, but definitely has a massive effect on it. So the cost of living crisis is having a huge effect on Britain's wallets, and will have a huge effect on health. With families really struggling, unable to afford, healthy meals or meals at all. How can the government help the most vulnerable this winter in that sense? And I'll come to you first, Caroline, on this one, if that's all right.
Yeah, I mean, this is, it's like the culmination of a lot of what we've been talking about, isn't it? And the really most critical and acute challenge. And there was a report just last night, actually, from the End Fuel Poverty Coalition, talking about they are expecting a kind of surge in excess deaths because people aren't going to be turning their heating on in this freezing weather. And so looking to what the coalition members there are saying, obviously we've had some interventions from government with kind of rebates back to people, but for many it's not sufficient. We're starting to see some more coordinated progress around kind of warm spaces and kind of communities coming together to find community spaces, but even that can be challenging for the most vulnerable people who maybe can't get out of their house in order to get to those warmer spaces. We've seen, particular patient communities. I'm thinking of those, for example, with high energy use equipment at home, maybe home dialysis, that sort of thing. The patient groups have really come together to make a very powerful and vocal case, and it's been striking actually how much that's really caught, and people have been talking about it more. So it's kind of across the board. And I think we do have to, I think there is a need to really listen to the voluntary community sector, what they are saying. I think I would like to hear more from government kind of about how to support that sector who are so close with their kind of communities and can kind of give more direct support. And I feel like there's been a real absence actually of discussion about what charities and what it's kind of worrying, I think, that whole sector is being sort of not brought into the kind of conversation as much as we would expect. So I think really channeling funds through them, and just I think it's going to take again kind of courage to not hide away from the issues. The government can't be blamed for everything. There obviously are kind of global headwinds that are making a lot of these situations worse, and I think having the courage to really face them and really talk about them and kind of come together to encourage the communities to do everything they can to support is very necessary.
Right, I'll come to you next, Amelia.
Yeah, I mean, if you ever needed more convincing that social determinants of health matter, then I think all you need to do is read a bit about the cost of living crisis. And I don't want to bombard anyone with stats, but I mean, to put this into some sort of context, nearly 10 million adults have experienced some sort of food insecurity in the past month, which in itself is linked to malnutrition, obesity, eating disorders, depression, you know, these big issues that the health and care system is dealing with. I think credit where credit's due. Yes, it is flawed, but the government has taken a step in the right direction with the introduction of the energy price cap, because I think in the short term, most people would say that that's where they need the most help. But longer term, because this is going to go on far beyond winter, I think the question for the government is how can they make that support more targeted to support people to prevent people rather from getting ill, and as Caroline touched on, to support people who are already ill and vulnerable. And then let's not also forget that the government is the country's biggest employer. So there's 1 million staff working in the NHS alone. And given what we were saying earlier about staff retention being so important, but staff morale basically never having been worse, and having only been exacerbated by the cost of living crisis, how can the government support the people that it employs as well?
Thanks. I'll come to you next, Ed.
Yeah, sure. And I mean, in healthcare, I guess kind of there's a bit of a cycle where every now and again there's a big debate around those wider determinants of health, what they mean and how we engage with them. And I think they've kind of been lost in the current political debate a bit at the moment. But I think, you know, as Amelia says, it's blindingly clear at the moment. The actual big things that will be driving a lot of these problems are things such as lack of heating. You know, if you're a patient, for instance, with asthma or a risk of CVD or pneumonia, you know, you have a massively increased risk of an exacerbation or of, you know, your condition worsening. And you kind of, I think what's really critical is that we need to have that targeted support for those people as well, and make sure that, you know, we have kind of firm plans in terms of how we engage with those, both actually at the voluntary sector, as Caroline said, and indeed through locally coordinated and national kind of action in and around this as well. But I think as well, it's, you know, it's things that, you know, you really wish that we weren't looking at in the UK, from malnutrition's potentially a large challenge that we'll see. And I think that's particularly a problem in children. And there's a big role that we have to make sure that we appropriately fund kind of school dinners at school, and we have the appropriate kind of safeguarding that exists in and around that. But I'd also say even more than that, actually, there's a massive mental health aspect to this, because, you know, one of the things you always see when you have the cost of living crisis is a corresponding increase in personal debt, in people having to take money out at extremely high interest rates, and that has a well-trodden, well-known correlation. So it's making sure that people have access to those services around effective financial management, around obviously mental health support services as well when they're able to access them, and ensuring, as ultimately these things do, is that we tackle the intrinsic health inequalities that exist as part of that, because these things are always felt more sharply in poorer areas, because they're the ones that are hit hardest by these cost of living pressures, but at the same time, for many reasons, have the poorest access to healthcare. So again, it's not an easy problem, but there's lots of different things that we need to do.
Thanks. I'll come to you last, Emma.
Yeah, I mean, look, I don't have much to add above what my colleagues have said about some of these macro challenges and what's needed to keep people healthy through this difficult period. I just wanted to mention two more discrete things, I suppose. The first is the potential impact of this crisis on people's willingness to travel for NHS care. We know in various disease areas that that's already relatively challenging for certain parts of the population, certain communities, and that it can be part of their decision to not take on certain treatment regimens is if there is any travel time associated and the cost of that travel. I think something really simple and straightforward that, you know, could be put in place for the NHS is kind of an expansion of opportunity to fund, subsidise some of those transport costs, so that we are, and you know, this also links to the backlog and getting back on top of that, so that we're doing everything we can to support patients to get through their treatment, and that isn't a barrier for them. And then the second thing I'd just flag is that NHS staff, especially GPs and in the community, can end up being on the front line really of people's conversations about some of this stuff. You know, quite a lot of people, if they're struggling, might not know where to go, and it might be that the first place that they're able to have a conversation is with their GP or with a health professional. And so those individuals on the front line need to feel that they are supported in their ability to signpost those individuals to appropriate support or services that could potentially be outside of the health system. So again, I think that's something that's, you know, relatively straightforward, you know, a package of support interventions that could easily be signposted to if these people who are really vulnerable are showing up within the health system and actually just need some support from elsewhere.
Thanks, Emma. Brilliant. Well, I'll come to the final question before we move to the audience ones. So digitalising the NHS, how can the government and NHS work together to free up carers' time by making the system more efficient by introducing new initiatives and technologies? I'll come to you first in this one, Ed, if that's all right.
Yeah, sure. And I think there's things that can be done at multiple different levels, all the way from primary care and, you know, the effective use of kind of embedding telehealth as a way in which we can reduce the pressures on primary care, and that we can allow people to access more efficiently, more effectively, and looking to bed that in. But actually, one thing I wanted to talk about, which I guess is a bit more general, is around how the NHS uses data, because I think that's really quite critical to all of the conversation around digital health, because the NHS is in quite a unique position in the quite rich data sets it holds, the rich databases it has, and its challenge is it doesn't use those effectively. And essentially why it's important is on so many different levels, you can better coordinate care patterns, care pathways, all the way through to, you know, it's actually a resource that through anonymizing the NHS can use to drive innovation, or even, you know, when appropriate, monetize with partnership with kind of, you know, effective partners. So it's both that improvement stream and revenue stream. But I think, you know, as part of that, they have to make sure that they do a big piece on trust in that. I think we've seen that with care.data and other things in the past, where basically, you know, you have to prepare the ground. You have to make sure people are ready and understanding that, because if we get the data piece right, not only can we improve existing pathways, we can revolutionize drug research, drug trials, you know, understand new patterns that we didn't know were there, for instance, that can lead to treatment breakthroughs. And I think it's a really exciting thing. The NHS is in a reasonably unique position because of the structure of our healthcare system to be able to do, should it essentially, well, get it right, I suppose.
Thanks, Ed. I'll come to you next, Emma, on this one.
Yeah, I mean, I completely agree with Ed. I just think the foundational question here isn't about digital and solutions and apps and tech. It's about data, because you just can't integrate these technologies until we get the data infrastructure right. You can't have a system where one trust can't look at the scans of another trust, or, you know, whatever it is. There are all of these challenges in the system being able to talk to each other in a meaningful way across that data spectrum. So, like, fundamentally, that has to be right first. And I kind of feel like all of the answers and solutions on that are there, and there is a willingness from the system, from health professionals, from patients, to see movement in this area. It's perhaps been a bit frustrated by various kind of restructures of core national teams where this agenda sits. So it would be great to see going forward a bit of continuity around that agenda and leadership, so we can just get on with some of the doing. I think the other point is that I think there's a lot of well-meaning innovation in the digital space, which sometimes doesn't always necessarily speak directly to the real challenges that health professionals or patients are facing. And so if there could be in that early kind of research and development space, a way that the NHS or the government could better unlock a dialogue with the system, with health professionals, so that the innovation is directly addressing the right part of the pathway, the right audience within that pathway, I think that could lead to better implementation and integration of those technologies, because I think they always come with solutions that the NHS couldn't necessarily come up with themselves, but sometimes that conversation about how it will actually get implemented happens too far down the development pathway, and so you kind of end up with something that has all the right intentions and at its heart is trying to solve the right problem, but hasn't necessarily worked with the system in a way that means that it can then slot in and actually work with the rest of the pathway.
Thanks. I'll come to you next, Caroline.
Yeah, I agree with everything that's been said, and I think you know, for particularly in the private sector, there's sort of incredulity, isn't there, at how far behind you know, the NHS and our wider health kind of system is in not adopting quite obvious and straightforward back office functions or kind of supporting technologies that could really very quickly and fairly, you know, simply at the front end kind of make quite radical difference. I mean, I guess we have this particular challenge of the fragmented system that does not support the adoption of all sorts of innovations. And, you know, this is another real case of kind of the scars on the back of trying to do more whole-scale change, and it being you know, either hugely overpriced, you know, and kind of hugely over budget as the years have gone by, not delivering what it was supposed to deliver, you know, and kind of all the kind of loss of trust and faith in that. So I think, you know, on the one hand, you know, we do need, again, kind of real national commitment to finding a solution that kind of covers the whole system in terms of some of that back office, to join up all of those different parts of the system in a way that I think any patient or healthcare professional looking at it kind of objectively would expect to be there, and, you know, in the way that it is in most of other parts of our lives now, and then you know, looking again and really focusing on the systems in place to kind of enable the rapid uptake of proven technologies. And we saw just this week Lords Adebowale and Bethel coming together in a kind of howl of pain about the kind of the heartbreaking lack of uptake of innovation when they are kind of, you know, good, proven, you know, they've been heavily invested in by the NHS at that kind of early stage, and then just the adoption isn't happening. We're expecting a medtech strategy. We have been for some time. Latest I hear is January. It's kind of it's coming, and some of, I think, the implementation for that is already underway. So potentially, you know, that does give us, you know, another lever. But this one does feel like, unlike some of the other kind of challenges that we've talked about, this one feels solvable, right? Like, this feels like we can make this happen. You know, there are systems out there that could really deliver this and have a fairly swift impact if only the kind of political will, commitment and investment were put in place.
Thanks, Caroline. I'll come to you last, Amelia.
Yeah, I think much on the same theme. There is so much exciting, shiny new tech out of there, and that is good. But in all of my time working with trusts and patients and families, the number one message I consistently heard was get the basics right. So as Emma touched on, that is things like, can you make sure everyone who cares for me, from my GP to my hospital doctor to my community therapist, can actually talk to each other and access my notes so that I don't have to endlessly repeat myself and they get the right care. And I think when we consider innovations like supported self-management, wearable tech, how is that going to fit into that pathway? You know, if you don't redesign the pathways, then you might make care more digital, but you don't necessarily make it better. And then the other point I just want to end on is keeping the patient at the center of all of this. So National Voices in particular have done some really interesting work in how do we introduce digital care and other innovations in a way that doesn't make exclusion worse for certain groups, be that people with lower health literacy, people who live in parts of the country that still have excruciatingly poor Wi-Fi, or perhaps they have no computer at all. And I think that kind of health inequalities thread that we were talking earlier about is really important to hold on to here as well.
Thanks, Amelia. Thank you. That's great. We'll now move to the audience's questions for the last part of the session. So yeah, thank you very much for the questions coming in. The first one would be, what are the biggest political challenges facing the pharmaceutical industry going into 2023? I'll start with you, Caroline, on that one, and that's all right.
Well, it's I think the tension between all of the positive language about life sciences being the jewel in our crown, and you know, the kind of the future of our leadership in kind of in research and development, and the, you know, the kind of the elephant in the room around the access and uptake challenges and the commercial kind of challenges that are being faced. We all have been involved in kind of conversations about how, for example, the existing voluntary rebate scheme is really impacting UK life sciences industry's ability to, you know, continue to focus as the UK as a kind of as a priority market, and those conversations are becoming more vocal, more public, more strident, and you know how it's not going to kind of break in terms of a kind of national political story, but it does kind of undermine and chip away at some of those kind of you know, the kind of big bold ambitions that the government want to have. So I think that kind of ongoing tension is something that is going to continue over the coming couple of years.
Thanks, Caroline. I'll come to you next, Amelia, on this one.
Yeah, I think Caroline's really covered the main points. I mean, in my time working in the, you know, the cancer charity sector, I think a lot of the tricky debate that pharmaceutical companies had to manage then and still have to manage now is around price of innovation. The other thing I would add that I think is interesting is I think there was a lot more of kind of political and public goodwill in response to the COVID pandemic, when the role of pharma and biotech and others really came to light. And I think some of that has fallen away now. So I think one challenge is how can some of that be recaptured?
Thank you. I'll come to you next, Ed.
Yeah, sure. I mean, look, I agree with what Caroline said, and I think it kind of goes back to the basic tension about two of the government's biggest priorities, which is growing the economy and making sure the NHS doesn't fall over. And when you come to things like VPAS, there's that direct tension between wanting to grow the life sciences industry, but at the same time wanting that rebate, wanting that funding, and wanting to plough that back into the NHS. And that's a challenge. I think, though, that what we'll potentially will see in a broader sense over the next probably 8 or 9 months is that as we come out of the winter period, where the government's essential strategy is, we know this is tough, we have to accept it's tough, we almost wear it a little bit, is that we then look to try and create the conditions for growth as quickly as we can so that we enter a general election in, you know, around 2 years' time, where we can point to those green shoots and say they are there. So I think you will see a bit of a reorientating in how they look at these things and how they operate based on that political strategy. But I think the challenge is essentially that warm words are great, but they don't really mean very much in terms of investment.
Thanks, Ed. And Emma, I'll come to you last on this.
Yeah, I mean, I think there's three fundamental things here. There's price, and obviously VPAS and the discussion around that will be the priority for the significant future. But I think underneath that, there is also a conversation to be had about future-proofing our approach to innovative pricing models. Like the pipeline coming through in lots of therapy areas requires a very different approach on how we consider pricing, so that we're able to get the right treatments to patients and that we are actually valuing those treatments in the right way and therefore paying for their actual value, rather than kind of a one-size-fits-all approach to price. So I think that's an important element that will become increasingly part of the dialogue as we get over the fundamental hump of the really big pricing discussion. I think there's something about uptake that is increasingly becoming quite challenging as the system is struggling with backlog and as there is less bandwidth for the NHS to consider shifting pathways, moving innovations in and out. So, you know, we've got lots of examples where you see these really great deals being struck and this quick access to treatments, and then the reality on the ground is that they're not reaching everybody that could be benefiting from them. And, you know, where's the agenda to really understand what's going on there? What's the data on that look like? And how do we come up with solutions to address that? And then finally, I think there's something increasingly of concern around the environment for like late phase pharma clinical trials in this country. And we've been one of the slowest countries to recover from COVID, in terms of our backlog, that is undoubtedly having an effect on our ability to run trials. There's also perhaps a stronger government agenda on early phase research, which obviously is critical, but perhaps less of interest to pharma from an investment perspective. So we also want to be a country that we want to invest in from an R&D perspective. So that whole policy agenda about how we unlock that environment within the NHS for clinical trials will become really critical, I think.
Thank you. The questions are flooding in now. So one on the levelling up agenda. And the health mission in that, is that seen as an opportunity for cross-government, a long-term focus on health inequalities, or is it not seen as a government priority? What are your thoughts on that, Ed, if I come to you first?
Yeah, I mean, I think it's fairly clear it's not a government priority at the moment, in the sense that we've seen a lot of the key bits of, we mentioned the health disparities white paper. I mean, it's in theory not been formally cancelled, but it's very much MIA. And, we've seen that kind of been dropped down the agenda. And I think that goes back to the points everyone's made about why, is that when you're in a crisis mode, it's hard to take that long-term thinking and kind of look further forward. I think that said, more broadly, the health inequalities agenda isn't off the table for, you have the programs like Core 20+5, kind of OHID as well, the Office for Health Disparities. And, there are these kind of, if you like, bodies within NHS England which will have that permanent focus. I guess if the question's more about how levelling up is in a political sense, I think that it's not as big a priority, but what you will probably see in the run up to the next election, particularly in a lot of red wall seats, is a lot of kind of, because Labour will seek to make it an issue, is where have you levelled these things up? What has happened? And the government's going to have to at least create a narrative in and around that. So it creates an opportunity to engage in that sense. Although I don't think you're going to see substantive change between now and the next election. There will be a narrative and a political dialogue around it, which can present opportunities to, show impact in cancer, mental health, whatever. So I think it's not as much as before, but the opportunity hasn't completely gone.
Thanks, Ed. I'll come to you next, Amelia, on this.
Yeah, I think it took so long to define what levelling up actually means, and we kind of finally got somewhere with it, and then it's all stalled. I think at the moment, obviously Rishi Sunak has kind of repeated his commitment to the agenda, but we're still in a place of warm words and not so much action. I think the opportunity, as I said earlier, does lie at the local level, and actually there is already lots and lots of great work going on. I think, politically speaking, there's links to other agendas here. So if we think about cancer, and then, the long-term plan targets to diagnose 75% of people at stage 1 or 2 by 2028, etc. Those targets are just not going to be achievable unless you do level up and kind of boosts early diagnosis, for example, in the worst performing areas of the best performing areas. I think, time will tell how much action we do actually see from the government and how much it stays as rhetoric. But I think Ed is right. Closer to election time, those crucial red wall seats are going to have to say something. So they better start thinking about it now.
Thanks. I'll come to you next, Caroline, on this one.
I'm not going to add anything. I agree with everything that's been said, other than to say that I think Labour, to kind of just build on what Ed was saying, is really adopting this. They see real opportunity. I think Lisa Nandy, is taking her role very seriously and may, seek to kind of co-opt that language even more, because actually, unlike some of the kind of political phraseology over the last few years, levelling up is actually a really powerful, it's a really kind of powerful way of describing what is needed to happen. And I think, that kind of judo move of using it against them, I think we'll start to see more of over the next few months.
Thanks, Caroline. I'll come to you, Emma, last.
Yeah, I mean, look, I agree with everything that's been said. And I think that there is a language thing here. There's the levelling up agenda is entirely political and was a result of the shift that we're seeing at the last general election, and how you directly translate that into a health agenda, which is ultimately about unacceptable inequality. There will always be differences and disparities, but really our agenda is about the unacceptable variation that we see. I think when it's an agenda that's so focused on investment and money into certain regions, sometimes it's hard to then really directly translate into how do you shift that into a health priority, because I think we would all agree that it's not necessarily about building a new hospital in X region and that it's probably much more likely about engaging certain communities in X region to shift awareness, attitudes, behaviours such that the engagement with the health service is different. So I would love to think that when this government has settled down a bit, so it's how many weeks in, months in, not many, and they've got a ton of other stuff to focus on, that there is space to carve out in translating that agenda, which I think sticks for this government and indeed for Labour, as Caroline has said, into something a bit more tangible. And I don't necessarily think we need a health white paper, inequalities white paper, to do that. We just need to help unlock what the tangible actions could be that allow them to show progress on health in relation to that levelling up agenda.
Thanks, Emma. And I'll just come to one last question from the audience just before we finish up. What do you think is the barrier to embedding preventative measures for health and well-being, such as social prescribing or fitness and nutrition? I'll come to you first, Amelia, on this, if that's all right.
Yeah, I think it's the age-old challenge, isn't it, of having a political cycle, essentially, in that some of the benefits of these measures are not realised within the political term. So I think what would be helpful is where potentially are some of those quicker wins that we've been speaking about the whole time. And then I also think it comes back to that broader issue around prioritising public health and the extent to which that's really being done. I think there's, as always, there is no easy answer to that question, but I think I don't think it's a lack of clinical evidence, put it that way. I think it's the discourse around it.
Thanks. I'll come to you next, Emma, on that one.
Yeah, Amelia's completely right. I also think there's something about implementation at kind of a regional, local level of some of these initiatives where it's about where the money is and who holds the power in that pathway. And ICSs in part are meant to be tackling this, and you've seen in previous efforts, Devo Mank, for example, where what you have to do is unlock an entire pathway so that the whole system feels like there are benefits to be reaped. And if at the moment funding and funding incentives are totally locked into a model that's all about the provider trust, there's never going to be an incentive to really embed and get on board with these. So I think alongside Amelia's point around shifting the discourse, we also just need to build systems and funding flows that really incentivize the whole pathway to bring on board these initiatives, such that everybody wants them to succeed and everybody sees not just the patient benefit, which, as Amelia said, is obvious, but also the financial benefit, because that is what drives decisions.
Thank you. I'll come to you next, Caroline.
Yeah, I think that there was, as you said, Amelia, the kind of the cyclical nature of it, and there was a real dialing up of thinking about how some of these non-medical interventions could really benefit people's health, and we started to see a big kind of focus on it. There was, I feel, also a sense of somewhat cynicism that this was being seen as, it's like the either or, this was sort of the easier way to tackle some of these wider challenges that we've been talking about, which they're clearly not. They're clearly part, as Emma says, of this kind of wider pathway. So I think it's just about reinforcing that, it's not one or the other, it's all working in partnership, and that there are benefits of all of it, but that it cannot be seen kind of in a politically kind of cynically way of trying to do healthcare on the cheap.
Thanks, and I'll come to you last, Ed.
Yeah, and I agree with that, particularly the last sentiment about healthcare on the cheap. I think, look, prevention's, I think, talked about a lot, particularly by politicians, as a way of cutting costs within the system, without that recognition that you actually have to spend money to achieve it. If you want to tackle obesity, you need that proper diet, nutritional advice embedded in the system. You want to tackle mental health, you need greater support, you need wider things such as housing investment, etc. Now, obviously, these things aren't always politically possible, but I think it's understanding that you have to be very targeted with money and actually invest in it. But I'd say lastly, like, look, one of the biggest blocks we see on some of this as well, and we certainly saw it this year with the slightly short-lived, let's say, Truss government, is that sometimes political ideology gets in the way of measures that, that prioritise prevention, be that unhealthy eating, be that in things that's, smoking, sporting cancer. And, whatever your view is that right and wrong, that is often a barrier to effective public health measures. And, it comes down to that fundamental discussion, which we're running out of time, so we won't have, about what government should do and how it does it.
Thanks, Ed. That's great. Brilliant. Well, we've reached the end of this session today, so I'd like to just thank all the panelists for being here today and for all your great insights. So thank you very much. There will be a recording of the webinar on our website, which will be up in the next few days. So you'll be able to access it if you weren't able to join today. And thanks everyone for joining on the other side as well. And thanks again to all the panelists. Really, really interesting. And thanks very much. Have a great rest of the day, everyone. Thank you. Bye.
Everyone.
Thanks.
Bye.
Bye.
Thank you.